Hey guys, this is Nicholas. I'm here at the Center of Dental Professionals today. I'd like to take some time off to congratulate you on finishing your core class. I know it was a lot of hard work, 10 hours doing studies, so congratulations on that. I'd like to take some time off today to tell you how to set up for your room a limited tray, an adult hygiene, and also a basic filling tray. So today the first thing we're going to do is how talk about how the room should be set up like. So let me get on my gloves and we'll go through it. So first thing to remember is your personal protection equipment, and then also you want to make sure everything you have has barriers on it before you bring in a patient, a doctor, or anybody. It's for the safety of you and also the safety of your patient. So for your air water syringes, the curing lights and everything, once you put new ones on there, you want to make sure you cover them with a little plastic bags. Usually every office has some, so just find out where they are and make sure you cover it up before you bring in patients. Okay, so we did that. And then also your mouse and your keyboard, you want to always cover it up after each use. Make sure you wipe them down really well, and also put your blue barriers on it, and then also a chair cover over the keyboard. And then for your lights, also make sure you cover up the handles. This is where you turn it on and off, and then you or the doctor will grab each handle, so make sure you have it covered up. And then also for your chair, you want to make sure you have a nice bag over it, so when the patient comes in, it's all covered. And then when you work on the patient, anything, any spills or anything will land on this and not on your chair, so you can keep it really clean and make it last longer. Thank you so much, and I hope to talk to you soon. Hey guys, this is Nicholas from the Center of Dental Professionals. I just want to talk to you about what to set up for a limited tray. So with a limited, the main reason why we have limiteds is because patients are coming in because they have pain with some part of their teeth, or they haven't been in the dentist for a long time and they want to know like if their mouth is healthy, or they want to check out something that was done a while ago. They want to make sure it's healing properly. A lot of people have fears for the dentist, so whenever they come in, it's most likely there's something wrong with the teeth, and the doctor needs to do some work on it, or it needs to be extracted based on what the x-ray shows. So for a limited trace, all you need is basically a mirror, an explorer, a suction, and then air water syringe for the doctor. They'll come in, you take an x-ray of the area that's hurting, usually a PA, to make sure you can see the roots of the teeth. Bring them to the operatory. The doctor will take a look, diagnose, and we'll go ahead with treatment. Thank you so much, and hope to talk to you soon. Hey guys, this is Nicholas. Today I'd like to talk to you about doing hygiene. Most offices that you go to have assistants and a hygienist, and they'll do what is called a double hygiene, where the assistant responsibility will be cleaning up the room, setting up the room, taking notes, and chatting with the doctor, and also getting everything put into the treatment plan for it to be presented, where the hygienist only focus on doing the cleanings. So what you will need for double hygiene is your saliva ejector suction, prophy paste, prophy angle, a water syringe, mirror, an explorer, and a perio probe. You will need two scalers for posteriors, and an anterior scaler, and a cavitron for the hygienist. And you also need some 2x2 so the hygienist can clean off the teeth and anything that she peels off from the teeth. Hey guys, this is Nicholas from the Center of Dental Professionals. Today here talking to you about how to set up for a basic treatment tray. In most offices or most places, the dentist office is called a filling station. So here we are at the filling station. So for your tray, what you will need is a Q-tips. These are to get topicals. You have your dry angles. It goes in the back of the cheeks to help keep the cheek away from the teeth and also keep the teeth dry. You have your 2x2s for wiping off your dentist instruments. You have a cotton roll, usually goes on the bottom under the tongue to help keep the tongue away from the teeth and help keep your teeth isolated. You have your air water syringes, saliva ejector, high volume suction. For your anesthetics, you have a long and a short 30 gauge and a 27 gauge based on the doctor's preference. Your most common anesthetics, Septicane and Lidocaine. Again, that's also based on your doctor's preference. You have your anesthetic syringe holder, mirror, an explorer, a spoon excavator. The spoon excavator, once the doctor cleans out the teeth, they usually use this to go in, check and make sure that all the decay is taken out and everything is removed. You have your ball burnisher. When the doctor packs the composite, he usually uses the ball burnisher to make sure to push down on the composite to make sure it fills in all the groove and crevices. You have an acorn burnisher. It does the same thing. You have a plastic instrument on the end. It looks like a beaver tail, so some doctors call it a beaver tail. This is for mostly for the anterior teeth. You also have an articulating paper. This is to check the bite and make sure the patient is not biting too hard. You have an articulating paper holder, cotton pliers for picking up your cotton roll. You have a spatula for mixing materials, and then you have a wooden edges. This is for interproximals. When you're doing a mesial or distal, the doctor usually use this to make sure the contact is really tight. You have your articulating, you have your matrix band, some bite blocks, etch, burr block, slow speed and a high speed. You have your primer, your composite gun, and you also have your micro brush for picking up the primer to put in the teeth before you put on the composite. Thank you so much for taking time out of your day to watch me next on how to become a better dental assistant. Please stay tuned for more videos coming in the next few months to help you grow and also expand on your knowledge.